Hello again, Rusty Jenkins from Wasatch Physical Therapy in Layton, Utah. Today I wanted to talk to you about the benefits of using dry needling for patients that have headaches. So with any technique that we do, specifically with dry needling, there would be a detailed physical therapy evaluation that takes place prior to the utilization of the needling. And that's to determine what's causing the headaches. So if you have a joint dysfunction or any structural issues or limitations like a ligament injury or things like that, then we would be able to pick that up and utilize other techniques to clear that up, and then use the dry needling to help with any other issues that are continuing to cause the headache pain. So I wanted to show you some of the spots that can typically cause headache pain in patients, and these are specific to the cervical spine and the base of the head. So the upper trapezius, or the big muscle in your neck, is a common referral pain generator for headaches. So the X's represent a trigger point in the muscle, and the color corresponds to the headache pain coming from a specific muscle. So as you can see, the upper trapezius can send pain to the base of your skull, wrap around your ears, and settle behind your eyes. Some of the other muscles that can cause some of the similar headache pain are your sternocleidomastoid and your occipital muscles. So today I'm going to show you treatments for the occipital muscles and the upper trapezius, and show you how easy of a treatment it is, and if we can get some positive outcomes from the utilization of the needles. So this is specifically due to, or related to functional dry needling, which is taught by Ado Zylstra and Kineticor in Colorado. So shout out to them for teaching this technique. So with our patient, we'll start off with cleaning the skin to decrease the risk of infection. And again, this occurs after a good physical therapy evaluation to determine what's causing her pain or dysfunction, and then clearing it up with any other treatment techniques or modalities, and then use dry needling to help accelerate the process. So we'll start off by needling her suboccipital muscles, and those are the ones that sit at the base of your skull. So what we'll do is, with functional dry needling, we definitely want to treat both sides, because the muscles work together to maintain the stability and to control motion of your head on your neck. So those are two of the suboccipital muscles that we would treat, and then I'll show you the treatment to the upper trapezius muscle. Now, most patients with neck pain and headaches have a lot of tension in their upper trapezius muscles, and so this is a muscle that holds a lot of tension and will typically have a twitching response with the needle. So as I needle her, you'll be able to see the changes in the tissue with that needle. So you can see how it twitches right through there, and that's a good sign telling me that we're hitting a muscle that needs to be reset. Again, the same thing with the suboccipitals. We'll treat both sides of the upper trapezius to make sure that we clear up any dysfunction around that area. Good twitch there, you can see that. So that's the beginning portion of needling for headaches. What we would typically do is hook that up to some stimulation to decrease any post-treatment soreness and to provide some more input into those dysfunctional structures. And then we would treat corrective exercises to improve the outcomes. So if you or anybody else has headaches and would like to come in and have an evaluation to determine if dry needling is right for you, again, my name is Rusty Jenkins from Wasatch Physical Therapy in Layton, and our goal is to help you to get you back to life.